My name's John Halperin. I'm the medical director for Neurosciences here at Atlantic Health. I had the good fortune to come here about 6 years ago. A good example of how important clinical research is. Today we routinely use something called TPA, a clot-dissolving drug in stroke, and we know it benefits people. We know precisely what the risk is of using it. We know precisely what the potential benefit of it is. How do we know that that's useful? We know it because for several years patients enrolled in clinical trials. When we started those trials, the individuals who enrolled thought they might gain some benefit but didn't know for sure, and we knew as a society that this probably would be a benefit, but we had to prove it so we could make it available to the next patient, the son, daughter, brother, sister of the patient who we're dealing with today. Another question that I'm asked often is, what is the role of clinical research in the setting of the Atlantic Health System? This has been an active thing we've been working on here for any number of years, and it really is central to our mission. The mission of the health system is advancing the state of health care, providing the best there is out there. I'm delighted to tell patients perfectly seriously that we have anything they can do in Manhattan, we can do as well here. We're participating in trials that are not available in Manhattan. We're fortunate in that we're living in a time when medicine in general and neurosciences in particular are advancing so fast that it's really hard to tell where things are going to be 5 years from now or 10 years from now. Things that are obvious as likely to occur. We deal with stroke patients all the time. It's the most common reason a neurologist deals with a patient in a hospital. As of right now, we're able to help maybe 10 or 15% of patients with the techniques we have available to reestablish blood flow to the brain. I could easily see where advances that we're working on right now will allow us to help double that number, which would be just tremendous when you think that 750,000 people a year suffer strokes. Brain tumors are less frequent, but they're devastating. They're devastating to the individual, they're devastating to the family and everyone who touches that person. We're developing treatments now that should substantially improve that. Parkinson's is incredibly common. We're developing new medications all the time. We have surgical techniques that help with Parkinson's, and we have things that seem as simple as low-impact exercise such as yoga and Tai Chi that we see are helpful. We see in epilepsy, probably the commonest neurologic disease, new advances in surgical medical management that are just totally different from what we did just a few years ago. So there's so many different areas where the large number of patients who are touched by diseases of the nervous system are going to have the opportunity to have treatments that just aren't there yet, that are right now just a figment of my imagination, but will be there certainly within the next decade, if not sooner.